Hello students, today's topic is Pathophysiology of HIV AIDS. What is HIV? HIV is nothing but human immunodeficiency virus. So it is a unique type of virus and it is a retrovirus. Now how does it invades our body? It invades the helper T cells or CD4 cells, which are the immune cells and responsible for defense mechanism in a human body. So it's a life threatening global epidemic. It is preventable, manageable, but not completely curable. What is AIDS? AIDS is acquired immunodeficiency syndrome. HIV is the virus which causes AIDS and it is in total called as HIV AIDS. So, in this, the disease limits the body's ability to fight infection and reduces the T cells markedly. So, that is, it reduces the immune function of the body to such an extent that he becomes prone to the various diseases. So patients may have a very weak immune system or defense mechanism, and hence the patient is predisposed or is prone to multiple opportunistic infections, which is finally leading to death. So, opportunistic infections and malignancies that rarely occur in the absence of severe immunodeficiency, that is pneumocystis, pneumonia, central nervous system, lymphoma, that also are included in the HIV AIDS, wherein the secondary diseases are caused into that. The person with positive HIV serology who has ever had CD4 lymphocyte count below 200 cells per microliter or CD4 lymphocyte percentage below 14% are considered to have AIDS. That is, in HIV AIDS, the CD4 cell count goes down because of the destruction of the destruction of the CD4 lymphocytes by the HIV virus. Hence, its count goes below 200 cells per microliter or below 14 percentage. So, the person is said to have the AIDS. Now looking about the viral genome. So it is a icosahedral, that is 20-sided enveloped virus, and it is a family lentivirus and subfamily of retroviruses. Retroviruses are called as retroviruses because they cause the retrosynthesis of RNA to DNA. So here two viral strands of RNA are found in the core surrounded by protein outer coat. So this is the outer protein coat. Outer envelope consists of a lipid matrix which is specific viral glycoproteins are embedded. So here these violet color structures are specific viral glycoprotein. These knob-like structures are responsible for binding the target cell. So these knob-like structures, they attach to the CD4 cells and they attach their glycoprotein onto the cells and they enter into the cells. Now, modes of transmission of HIV AIDS. So as we all know that the HIV AIDS is not spread through the contact or through the sputum or any other body fluids, but it is majorly transferred or spread from one person to another through the blood products, semen and vaginal fluids. It is also passed or transmitted through the intravenous drug abuse. Now, for example, if a person is suffering from HIV AIDS and he uses one of the needles for injecting the abuse drug or addictive drugs, and he gives the same needle to another person, then the virus which is present in the person's blood goes to the healthy person's blood. So, if the needles are shared without sterilization, increases the chances of contracting HIV. Unsterilized blade. So if, for example, in a saloon, if the same blade is used for shaving all the persons, so one person, if he is having HIV AIDS, the other person may get it. So unsterilized blade are also one of the mode of transmissions. Now, unprotected sexual intercourse with the person affected or infected from the HIV AIDS can cause the HIV. Next is mother to baby. That is, if a mother is suffering from HIV AIDS, she can pass this disease to the baby before birth as well as during the birth. So we have majorly three modes of transmission. First is through the body fluids, second is through the intravenous drug abuse, third is through the unprotected sexual contact, and fourth is through the mother to baby. Then some myths are about the transmission. That is, we cannot eat together, we cannot work together, we cannot shake hands, but this is wrong. If you are eating, working, or shaking hands with an HIV affected patient, you won't be getting it at all. Natural course of HIV AIDS, that is how the disease progresses. So, first is stage 1. Stage 1 is the acute HIV infection, wherein the person is suffering from mild infections, flu like illness, occurs in 1 to 6 weeks after the infections. These are the having the mild symptoms. The infected person can infect other persons in this stage. So here you can see acute infection of HIV, which consists of fever, weight loss, malaise, body weakness, sores of the mouth, lymphadenopathy, skin rashes, myalgia, etc. So this may occur for a shorter period of time in the stage 1. Stage 2. Stage 2 lasts for an average of 10 years. This stage is free from symptoms. So there may be swollen glands. The HIV in the blood drops to the level of HIV in the blood drops to the low levels. HIV antibodies are detectable in the blood. So in this stage we can diagnose the HIV presence of HIV virus in the blood. Third is symptomatic. So wherein the whole HIV virus is deteriorated CD4 cells, the CD4 cell count goes much lower, then the immune system continuously deteriorates, and the person is prone to the opportunistic infections and cancer because his immune system is totally collapsed. Stage 4, the immune system is weakened too much as the CD4 cells decrease in very much decrease in number of the CD4 cells. The person is much prone to the opportunistic infections. Then opportunistic infections associated with the AIDS when CD4 count is less than 500. These opportunistic infections include bacterial infections, tuberculosis, herpes simplex virus, herpes zoster virus infection, vaginal candidiasis, hairy leukoplakia, and copsicossarcoma. Opportunistic infections associated with the AIDS when CD4 count is less than 200. So, pneumocystic carni infections, toxoplasmosis, cryptococcosis, coccidiomycosis, cryptosoriasis, and non-Hodgkin's lymphoma. So, these are the infections which are occurring when the condition is worse than the earlier, that is, CD4 count goes below the 200. Then much more worst condition wherein CD4 count is less than 50. So Mycobacterium avium complex infection can attack the person. Histoplasmosis, cytomegalovirus retinitis, CNS lymphoma, progressive multifocal leukoencephalopathy, and HIV induced dementia. So these are the worst conditions. Now tuberculosis and co-infections. Now, as we have already studied in the tuberculosis, that is the persons who are mostly affected by the tuberculosis are the HIV patients, because HIV patients, the immunity becomes such a low that they are opportunistic, or they are more prone to get the the tuberculosis infection. The tuberculosis is most opportunistic infection in HIV patients, and the first cause of mortality in HIV infected person, that is 10 to 30% of the patients suffering from HIV plus tuberculosis die. 10 million patients are co-infected in the world, that is co-infected with tuberculosis as well as HIV. Immunosuppressions induced by HIV modifies the clinical presentation of tuberculosis. So, there is subnormal clinical and row engine presentation, high rate of multi-drug resistance tuberculosis, high rate of treatment failure and relapse, that is reoccurrence. So, 5% reoccurrence is there in normal tubercular patients, but 1%, less than 1% reoccurrence in HIV patients. That is treatment failure in HIV patients. So HIV plus TB gives double trouble, wherein the person is suffering from both HIV and tuberculosis infection, wherein both are the dangerous ones. Then testing options or diagnostic tests for the HIV. So first is anonymous testing. So as we already know that the person who is suffering from HIV AIDS, and if he wants to go to confirm whether he is suffering from HIV AIDS or not, and he goes for blood test, so this blood test is kept confidential, his name is kept confidential, and he is named with an anonymous name, or a number is given, an identification number or unique identifying number is given to that patient, and results issued to only the test recipients, not anyone else. Blood test detection kits are also available. So HIV AIDS can be tested with the help of 3 to 4 tests, like HIV enzyme linked immunosorbent assay, that is ELISA. So it gives sensitivity more than 99.9%. Western blot test is also available, which is a confirmatory test after the ELISA, which gives specificity of more than 99% when combined with the ELISA. HIV rapid antibody tests, that is a test used to screen HIV. Then absolute CD4 cell count or lymphocyte count. So when the CD4 cell count goes below 500, then we can predict that HIV infection has been caused. Then urine test. Urine Western blot test is one of the tests wherein urine is used. So it is as sensitive as testing blood. It is a safe way to screen for HIV, because if the person comes in contact with the blood of the patient, then he may have chances of the HIV infection if that blood is exposed to an unhealed wound of the normal person. This can cause false positive results in certain people at high risk for HIV. Next, oral testing. So there is a test called as OraSure, the only FDA approved HIV antibody. So it is as accurate as blood testing. It draws the blood derived fluid from the gum tissue, not the saliva tests. Treatment options. So the treatment which is given to the HIV AIDS patient is called as HART treatment or HART therapy. HART stands for highly active antiretroviral treatment. So which are these drugs? So it consists of the combinations of the drugs of the different categories. So one category out of that is fusion inhibitors, which inhibit the attachment of the virus to the CD4 cells. Next is nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. These are the drugs which inhibit the retrosynthesis of the RNA from DNA. And protease inhibitors, these are the drugs which inhibit the assembling of and synthesis of the HIV proteins. So antiretroviral drugs or HART therapy includes the drugs like nucleoside reverse transcriptase inhibitors, example zidovudine, non-nucleoside reverse transcriptase inhibitors, example nevirapine, protease inhibitors, for example ritonavir. A healthcare follow-up of HIV infected patients. So for all HIV infected individuals, CD4 count should be done every 3 to 6 months. Viral load test should be done every 3 to 6 months and 1 month following a change in therapy. Then the care is taken, proper care is taken. Then isoniazid for with the treatment with positive treatment, and a normal chest radiograph. Then VDRL for syphilis, VDRL or RPS test for the syphilis. These are the tests used for the side infection, which is another sexually transmitted disease, that is syphilis. That is for testing this VDRL test is there. Then toxoplasma IgG serology is there. Cytomegalovirus immunoglobulin serology, that is to see the presence of IgG, that is immunoglobulin G, which is indicative of the cytomegalovirus, toxoplasmosis, etc. Then pneumococcal vaccine can be given in this case. Influenza vaccine can be given in the season wherein influenza can be more prone. Then hepatitis B vaccine to those who are HBs AB negative. Hemophilus influenzae type B vaccination, and Papanicolou smears every 6 months for women. So all these are the tests which are to be done, or the treatment which has to be given for the HIV infected patients to take care of them. Then for HIV infected individuals with CD4 count less than 200 cells per microliter, pneumocystis jirovecii infection can be occurring. For that, prophylaxis treatment is given. Prophylaxis means to treat the patient before the infection occurs. For HIV infected individuals with CD4 count less than 75 cells per microliter, they are more prone to Mycobacterium avium complex, so prophylactic treatment can be given to that. Then HIV infected individuals with CD4 count much lesser, that is less than 50 cells per microliter, so cytomegalovirus prophylactic treatment can be given. So prevention is better than cure for the avoidance of the HIV. First is abstinence. Second is monogamous relationship, protected sex, sterile needles, and new shaving or cutting blades. First is abstinence, that is refraining from the unprotected sex. Then it is most effective methods, and refraining from the intravenous drug use, that is saying no to the drug use. Monogamous relationship, that is a mutually monogamous relationship with a person who is not infected with HIV testing before intercourse is necessary to prove your partner is not affected. So what can be done to prevent the AIDS? So AIDS outcome framework 2009 to 11, so 9 priority areas are there which should be taken into the consideration to prevent or to reduce the transmission of HIV. So we can reduce sexual transmitted of transmission of HIV. We can prevent mothers from dying and babies from becoming infected with HIV by giving proper treatment, prophylactic treatment. We can ensure that the people living with HIV receive proper treatment. We can prevent the people living with HIV from dying out of tuberculosis. We can protect the drug users to become infected with HIV. We can prevent the laws, policies, practices, stigma, and discrimination which cause the social stigma to the patient. We can stop violence against women and girls. We can empower young people to protect themselves from AIDS and enhance the social protection by enhancing the social awareness. So this is all about the HIV AIDS, the pathophysiology, signs and symptoms, clinical features, diagnosis and treatment. Thank you.